How to understand your bone cancer diagnosis. Discovering you have bone cancer can feel overwhelming, but understanding what your diagnosis means is an important step toward managing your health. When your doctor suspects bone cancer, they start with a detailed review of your symptoms and a physical exam. Common signs include persistent bone pain, swelling, or fractures that happen with little injury. These clues lead to imaging tests that help visualize the tumor. The first imaging test often used is an X-ray. It can show abnormal areas in the bone, such as regions where the bone is breaking down or new bone growth. These findings can suggest bone cancer but are not definitive. To get a clearer picture, your healthcare team might order MRI or CT scans. Magnetic resonance imaging provides detailed images of the tumor and nearby tissues, helping to determine its size and location. Computed tomography scans give cross-sectional views, which are useful for planning treatment. Bone scans or positron emission tomography scans are also common. These tests help identify if the cancer has spread to other bones or parts of the body, such as the lungs. This information is crucial for staging the cancer, which tells you how advanced it is. To confirm the diagnosis, a biopsy is performed. This involves removing a small sample of bone tissue, usually with a needle or during surgery. The tissue is examined under a microscope by a pathologist to identify if it is cancerous and to determine the specific type of bone cancer. The pathologist also assesses how abnormal the cells look, which helps determine the grade of the cancer. A low-grade cancer has cells that look more like normal bone cells and tends to grow slowly. A high-grade cancer has very abnormal cells and may grow or spread more quickly. Once the cancer is confirmed, your medical team will stage it. Staging involves evaluating the size of the tumor, whether it has invaded nearby tissues, if lymph nodes are involved, and if the cancer has spread to distant organs. They often use the American Joint Committee on Cancer system, which considers tumor size, lymph node involvement, metastasis, and grade. This helps determine the best treatment approach. It is also important to understand whether your bone cancer is primary, meaning it started in the bone, or secondary, meaning it spread from another part of your body. This distinction influences treatment options and prognosis. Your healthcare providers will explain all these findings clearly and answer any questions you have. Remember, each diagnosis is unique, and treatment plans are tailored to your specific situation. To truly understand your diagnosis, ask about the meaning of your test results, the stage of your cancer, and what options are available for treatment. In summary, understanding your bone cancer diagnosis involves recognizing symptoms, interpreting imaging results, confirming the diagnosis with a biopsy, understanding the cancer's grade and stage, and discussing these details with your healthcare team. This knowledge empowers you to make informed decisions and work closely with your doctors to develop the best plan for your care. Always consult qualified medical professionals for personalized advice and guidance.